guys, welcome to Counseling Talk. Juan here, and I'm here today with Rachel Hutto, a licensed professional counselor. She specializes in trauma. She's actually a somatic psychotherapist. So if you're not sure what that is, we're gonna really pick her brain all about it and all about healing from trauma using a psychomatic approach. How are you, Rachel?
Yeah, I'm well, thank you.
So let's kind of start with where are you right now?
Literally, where am I?
Yeah, like
Yeah,
literally.
literally. I am sitting in my office here in Greensboro, North Carolina.
Awesome. And it's a beautiful office. I see that you've got those pictures up there on the wall?
Those are actually like acoustic boards to help with sound and soundproofing and that sort of thing. Yeah,
Okay, cool. I like that.
yeah.
It's a very like
My
comfy.
office is co-located with Still Point Acupuncture, so I'm a psychotherapist here doing my work, but then the rest of the building is Still Point Acupuncture, where they're offering their services. So
Okay.
yeah,
That's pretty cool. So I guess if people go there, they can kind of benefit from both services, the working with an acupuncturist as well as working with you in that somatic psychotherapy area.
yeah, absolutely. If they choose, right? I think there's a lot of good evidence to suggest that acupuncture is a helpful support for mental health and trauma. And so if people are willing, I certainly encourage, um, you know, working with multiple providers to help them to get to where they hope to be in their mental wellness.
Yeah. I
Yeah.
need to do that. I went to UNCG for undergrad, and I met
Mhm.
my wife there, and she worked for the wellness center. And I think she
Okay.
did a session with the acupuncturist, but
Okay.
something about people putting needles, right? Because it's kind of what they do. They put, yeah, I don't know. It scares me. I'm going to be honest with you. It's scary, but it looks relaxing at the same time. So I need to build that strength within.
Yeah. Well, this is going to sound like a promo for acupuncture, which is not really my intent, but there's also ways that you can experience acupuncture that doesn't involve needles. So they have like tuning forks where they can use vibration to do the points, or they can do it with touch as well. So you don't necessarily have to do needles to experience the
Oh,
benefit of acupuncture.
awesome. Okay, you
Yeah.
sold me.
Yeah, it's
You
the
may
most
have to.
common way to do acupuncture, of course, but if that is going to be interfering, they're certainly willing to do it in other ways.
Okay, cool.
Yeah.
So Rachel, I'm glad, I'm happy that you're here. I wanted to ask you if a patient in the community, you and I are both in Greensboro, someone in Greensboro is reaching out to you and they're coming with a history of trauma.
Mm-hmm.
How does that somatic approach connect with them? Like, how do you walk a patient all the way from, hey, this is, I'm Rachel, this is what somatic psychotherapy is, and this is what we're going to do to get you to that healing process?
Yeah. So I think that oftentimes the beginning part of the conversation, in addition to like helping people get settled in and those sorts of things, to understand somatic psychotherapy, um, understanding sort of a little bit about how our brain works and
Mm-hmm.
how our body is connected to our brain is pretty essential to getting that right. So when we think about triune brain theory, for example, where we sort of use this model of the brain, this being like our frontal cortex, where we're thinking, making decisions, that sort of thing. It uses the language of words, right? So you and I
Yeah.
are primarily using our sort of brain right now to be able to have this conversation. But of course, we're using the other parts of our brain, like our limbic system, which is our emotional system that's tucked in here. We're familiar with that, right?
Mm-hmm.
Anger, sadness, happy, joy, etc. But then when we understand trauma, we need to understand this is really being driven by the base of the brain. So what we call the old brain or the reptilian brain, and that's back here in the back of our skulls and runs down through our spinal cord. And so
Okay.
in order to effectively work with trauma, we can't just talk about it. It's
Yeah.
only really addressing one piece of it, albeit that's an important part of who we are as whole people, to be able to make meaning and understanding of our experiences. But ultimately, trauma is a body experience. And if we aren't working with that old brain, which uses the language of sensation, so
Mm-hmm.
like I feel tightness in my chest, my muscles are tense, my jaw hurts. Um, when I think about this, I get a headache,
Yeah.
those kinds of things. Like that's the language that our stress response system uses. And so my work is really helping people learn how to get familiar with the language of sensation, their experience with that. There's no one right way to be in a body. It's just whatever way you are in yours, and how is it that we can help you learn how to connect with that. And then ultimately, how can we shift how your body is holding on to trauma into something else, right?
Yeah.
What we call healing or transformation or recovery, whatever language sort of fits for a person. But ultimately, how do I move from something that's stuck, which is trauma, to something that is not stuck, which is healing, recovery, etc. And so my work is really a bottom-up approach based on what the physiology of stress.
Yeah.
Right. It's like the body only cares about what's overwhelming or scary to me and what's safe to me, right?
Yeah.
It doesn't get into all the gray nuances that our mind goes, which is important, of course. But to understand trauma, we have to understand that we're working at a very basic level, which is what's safe and what's scary. And someone who's experiencing traumatic stress in some way, their body's stuck in being scared. And my work is to help them use that language of sensation to move their body and their stress response system from being scared to feeling safe.
That makes perfect sense. And you said it beautifully. So a patient's coming in and they've experienced this trauma. Their body is scared. And you, from your end as a somatic psychotherapist, you're looking at a transformation or a shift on how do we move that energy. What are typical symptoms that, someone would be experiencing as they approach you, they're looking to work with you?
Oh gosh, the gamut is so broad.
I
But
know.
most people show up in some way because they're saying that they're experiencing some version of being stuck.
Okay, so I feel stuck.
I feel stuck, right? Like, so I understand this. I get where this is coming from. I've had these kind of experiences. I've had anxiety for my whole life, but I still feel stuck around it. Like, I've tried these things and I've approached it in this way, but something still hasn't moved for me. So they're describing their symptoms, and whatever that might be, it could be these traditional symptoms of anxiety, disruptions in sleep.
And those will be like the physiological symptoms as far as the disruption in sleep.
Sure. And I would say not everybody, most people aren't coming in here knowing how to listen to the language of their body. And so part of my job is to teach them how to do that. Right. And that's okay. Nobody needs to come in here knowing how to feel that. They just know that they're stuck in some way. Right. And so if you know how to listen to your body, then great, that's welcome. If you don't know how to do that, that's okay. My job is to support you in being able to do that. So wherever you are, we begin at the beginning, of course.
I like that. You're there to walk with them on their journey. And some of those symptoms, they make perfect sense. I'll work with patients and they'll share, I feel stuck, or they'll share a level of acceptance. Like, I've always had this anxiety that came from this trauma. Do you notice that, I guess from your end, when you're looking at that shift? And I don't know a lot about somatic psychotherapy. So if someone comes in with, it's a trauma, post-traumatic stress disorder, and they're sharing disruption in sleep, I can't sleep well, or I'm having distressful flashbacks, I'm having thoughts of that trauma that took place, my body shakes, my hands shake, I get restless, I get rapid heart rate, just like those check marks, as far as, okay, these are the symptoms that connect to trauma.
Right.
Whenever you're working with them, how does that somatic approach integrate into shifting the energy that they're showing into something a little bit healthier?
Sure. So I'll talk about that piece specifically, but I want to back up a little bit first and say that it's an important part of working with anyone that they have some stability first, right?
Yes.
That means looking at things like, what does movement in your life and exercise look like? What does spirituality, or if that's important to you, what are those practices looking like?
What do you look for?
What are the what are the nutritional deficits or areas of of that are, a lot of times increased anxiety and traumatic stress symptoms are exacerbated because you don't have enough protein in your diet, for example. So we're looking at sleep hygiene. So I'm assessing those factors as well, because a lot of times we need to get some stabilization around some of those things before you can actually go in and do any direct work around the trauma, right? Like there has to be some stabilization in a wider sense. People can't walk into my office day one and then we delve into the deepest parts of trauma, right? So I just want to be clear that the process is beginning at the beginning, and as people's stability and capacity grows, then you can work more and more with that, those sensations and symptoms that you're describing there. And so once that piece can happen, so if someone's sort of working with these sensations, in part, it's like, ultimately, I'm looking for how is your body stuck in fight, flight, freeze responses, right? So,
could you describe those?
Yeah. So fight could look like a lot of things, which is that like I stay on edge.
Yeah.
I'm constantly looking to push back in some way. I'm constantly waiting for something to come at me that I need to respond to. It could sometimes literally look like I start a lot of arguments or fights with people, right? Flight can look like I can't stay in relationships, or I can't even stay present in a room. I disassociate, I disconnect. I make a lot of changes in my life because I can't stay present with anything.
Yeah.
And freeze can look like a lot of things too. It can look like depression. It can look like immobility. It can look like I can't make change. I can't get out of bed. Like I'm frozen, stuck in some way. And so ultimately it's like, how can we support a shift from the symptoms that you're currently having to one where you're not in these fight, flight, freeze responses? And so sometimes that looks like skills of like, how can I literally shift from dissociation to presence, right? And so I'd be like, can you notice yourself in your chair? Can you wiggle your fingers, right? So something, whatever that person sort of needs to shift that experience in some way. So somatic work it's not a module. It's not like you do this and then you do this and then you do this. It's learning how to listen to the language of the body. And so there's not one way in which this all works. It's very much working through the present. So what's the experience that you're having right here, right now? How can we support that? And so again, sometimes it's developing skills or practices. Like I do some things like teach heart math. I do some EFT tapping kinds of things, some basic, mindfulness. Some of those kinds of pieces are certainly.
What are some basic mindfulness strategies that you'll implement? I know you shared the one as far as, wiggle your toes or describe, where you're at right now. What does it feel like?
Sure. So I think that really anything that I think of mindfulness as really anything that can help somebody be right here, right now, right? Yeah. So if that's counting backwards by 7 from 100 in your mind to help you be right here, right now, if it's helping you get oriented to sensations in terms of like, what am I seeing, hearing, smelling, what textures can I touch, right? Any of those kinds of things that are going to help with the intention in this, I guess, orientation is about like, how is that bringing me back to right here, right now? Because ultimately that's what trauma is the inability to be right here, right now, because our stress response system is stuck on in that scared place. So anything that can support that turning off, even in the slightest amount, is moving us in the direction that we want to go.
Okay. And you said that perfectly. I'm going to rewind it and ask it in a different way.
Sure.
Because I understood it very well, but I want to make sure that everyone listening is able to catch that. So when someone's coming in with trauma, they're showing a lot of those symptoms that you shared prior.
Right.
And engaging in that, somatic psychotherapy, utilizing mindfulness approaches to bring them into the present moment. And when we look at those skills, such as tell me right now, what do you see around you? Or wiggle your toes. To an extent, it's like, well, that's really simple, right? I
Mm-hmm.
can tell you what I see around me. I see the sun, I see trees, I see this water bottle. But from your end, as a psychotherapist, what's really happening there?
Yeah. So what's really happening there is the stress. So the stress response system. Imagine that like, trauma happens. If we go back to this model, we're talking about the base of the brain and down the spinal cord. Like this is like Las Vegas at nighttime. It is like right, like all the bright lights are flashing and like there's just stimulation everywhere. And so whenever that happens, I can wiggle my toes. I can come back to present. Like this can turn off some.
Mm-hmm.
Those lights can dull a little bit or maybe a lot depending on where someone is at. So that's ultimately like, how are we getting this part to settle down, turn
Yeah.
off, you know?
Yes.
So it's like dim the lights on Las Vegas, essentially.
And then what do you look for over time, right? Those lights are dimming. Does the increase in those, healthier strategies, the somatic founded ones, does that start to dim the lights until the point that the trauma shifts in its energy, transforms, becomes something else?
Yeah, ultimately, what the intention is like, how do we get your stress response system to work only when you need it to?
Yes.
Yeah. So it's not about like, it's like taking something that's always on like Las Vegas and like you can control the lights. Right. So like if something scary happens, you get in a car accident, for example, or something, right? You want your stress response system to work to keep you safe, to work towards your survival. But then when that event's over, we want to have the ability to turn off. So, a healthy stress response system has the ability to do that fluctuation between turning off and on, depending on your circumstances, rather than a traumatic stress state where automatically it's outside of your control cognitively in your consciousness, but from that unconscious automatic place you're just on all the time, and that's is depleting. Ultimately, we can't live a well life when our stress response system is on all the time. And so the hope is that then folks can feel vitalized, they can feel resilient, they can feel alive in their lives, where like, yeah, I can do the things that matter to me,
Yeah.
participate with my family, do the work that I enjoy, travel, etc., whatever that might be, knowing that like I don't have to be on all the time, and just when I need to, and that I have the ability, the skills to feel like I can regulate myself, I can know what my body is saying and be able to take care of that,
Mm-hmm.
as I continue to move forward in all the variables that life brings.
Wow. I'm just thinking about the very beginning of our conversation where we went into what is that person, what is it, what do they look like? Where are they at? And you used the word stuck, right? I feel stuck in my life. And then now that transformation is that, I'm vitalized. I'm able to have wellness. I'm able to live my life in a very healthy manner and function in the way that I want to function. I'm in
Right.
control of this vessel, if you will.
Right.
Rachel, if individuals out there want to connect with you, if they want to work with you, what's the best way to contact you?
Yeah, so I'm here in Greensboro, willing to see anybody who's willing to show up in terms of distance, etc. But I have a private practice, and my website is bestillpllc.com. So the name of my practice is Be Still Counseling. You could also just Google that, and my website will show up there, and it has all my contact information in terms of like an online contact me form. You certainly could call me if you have questions, those sorts of things. So I am willing to provide a free 30-minute consultation for folks who are just sort of like, I don't know what this is about, but I'm maybe kind of interested. Could we chat through this a little bit? So I'm certainly glad to do that, because I get that my work is a bit outside of what we might typically expect from psychotherapy.
I love that, and all that information I'm going to put on the show notes, so that if you're watching, you're able to get the contact, the phone number, and hopefully you're able to connect with Rachel. I'll share with you as a clinician myself. Whenever you're reaching out and you're working with counselors in the area, we don't know everything. We're able to work on one puzzle piece out of the hundreds of puzzle pieces. And if you're working with, and when I work with a patient with trauma, I'm engaging in a lot of what's called talk therapy. I'm looking at understanding the trauma, digging into it, and listening here and being with Rachel. I'm able to see how, if she and I partnered and worked with a patient, we'd be able to, engage in an amazing transformation. And, really that's the same thing as feeling a little bit stuck and going to get a healthy meal. And then afterwards saying, you know what, I'm gonna go to the gym too. It's combining efforts, in order to move forward in life. So thank you
Yeah.
for, go ahead.
Yeah, and thank you for mentioning that. I'm certainly glad. Like, some people see me just work with me and I sort of do all those pieces, but I love working collaboratively with other
Yeah.
folks, right? Like, I get that I'm one piece of it. And so it's really common that folks come to me to do the body somatic work, and then they have, other therapists that are helping them with some other pieces of things. And so, yeah, glad to work that way.
Awesome. Well, thank you for being here, Rachel. Have an amazing day.
Great. Thanks so much. You too.